Even issues like getting along in high school and learning to adapt to a new environment can be helped quite a bit. Razia, I want to ask you a quick question about the, you had mentioned a number of triggers. Another one that we've also noticed is the impact of the economic crisis. Can you talk very quickly about whether you've seen an effect on South Asian communities as a result of that?
Absolutely. I'd mentioned earlier we tracked some of our data in terms of referrals, and definitely right around October, November, there was a double in intakes right around that time. It stayed pretty highly consistent since then. Not everyone is citing economic as one of the reasons, but definitely the referrals have gone up, and other things that may have been kind of okay have definitely started going in a direction where they're seeking more help. And where I'm seeing more of the impact of that is some of the a free health clinic and seeing people accessing services for therapy there.
So loss of jobs, losing your home, things like that can really lead you to feel that you need more assistance.
Absolutely. That's when the stress level goes up. That's when you feel hopeless. That's when you may feel desperate. That's when if you don't feel you can turn to anyone else. And that's when you also may want to keep up the image of, you know, being the model minority, that you don't want to let people know what's really going on.
We talked about some triggers. We've talked about some of the situations that South Asian families and individuals might be facing. So if you or someone that you know is really in need of assistance, where can you turn? So I'm going to ask Mala first to talk a little bit about both the Multicultural Clinical Center as well as government agencies and other organizations that might be able to provide assistance. Mala?
Okay. Multicultural Clinical Center has therapists from many different cultures and languages.
So what about some government services that are also available for people in the area?
Most of the counties, Deepa, they offer mental health services. They have separate departments for that, such as Alexandria, Arlington have a very strong mental health departments, and people can access them at any time. Most hospitals, local hospitals, deal with the mental health emergencies as well. So those are good resources. Besides that, I think Northern Virginia Family Services and Falls Church, and I believe Crossroads in Manassas also offer multicultural services, mental health services.
Let's talk a little bit about DC and Maryland, and especially hear about some of the nonprofit services that are available, including CHAI.
CHAI is a nonprofit, and our mission is to help educate and find referrals for people on mental health and wellness issues. In conjunction with that, we also work with mainstream organizations such as the government or organizations or clinics or other places to ensure that they're reaching out and offering the services to the South Asian community. There is a free medical clinic, the Muslim Community Center Medical Clinic in Silver Spring, Maryland. And so for residents in Montgomery County, we're able to offer free psychiatric services and therapy services through this initiative. And it's been very successful. And this is open to any resident of Montgomery County who is uninsured. Also in Howard County, Maryland, through the Department of Health and Mental Hygiene, they also were able to contract with a psychologist who can specifically work with South Asian clients.
Great. So it sounds like there are nonprofit, for-profit, and government agency resources in the District of Columbia, in counties in Maryland, as well as in Virginia that people can actually access. And it also sounds like, for example, many mental health professionals are doing a lot of advocacy to make sure that government agencies and other professionals are aware of what are the issues that affect South Asians and how can you provide more culturally and linguistically appropriate services. I want to thank our guests today, Razia Cozy from CHAI and Mala Tandon from the Multicultural Clinical Center, for spending some time with us and making it clear that for all of us in the South Asian community, we don't need to be silent and that there are resources out there that can assist us if we need them. I want to thank all of you for joining us on Community Corner, a new segment here on Drashan TV this month. My name is Deepa Iyer. I'm your host. I'm also the Executive Director of South Asian Americans Leading Together, which is a nonprofit organization that is sponsoring Community Corner every month, where we'll be coming to you to talk about some of the issues that affect the lives of South Asians here in the DC metropolitan area. You can learn more about us at www.saalt.org, and we hope to see you again next month. Thank you.